Good evening, everybody. I think we'll go ahead and get started. I do want to say that we're in quite a large space for not a large crowd, so if you want to move closer, you're more than welcome to make it a little more conversational, perhaps, but we'll get started. I do want to just begin by saying thank you for being here. You know, if you're a resident here on JBLM, thank you for coming tonight to hear about what we're going to talk about tonight, which is lead in on-base housing. If you're part of the leadership team that's here, thank you as well for coming to help get the information. And you know, what we'll talk about tonight is not just sort of the status of things, but what the way forward is. And so your presence here will help us as we communicate that. And then also thanks to the team here that helps do what we do in support of the installation, and I know there's quite a few of you that are in the room tonight. So, by way of introductions, I'm Colonel Nicole Lucas. I'm the Garrison Commander for the Joint Base here on JBLM. My Deputy Commander, Colonel Bill Percival, is here in the front row, and then I have a team of experts here that are going to help with the discussion.
Yes. I'm Steve Perno, Director of Public Works.
And I'm Tom Brown, Regional Vice President for Lincoln Military Housing.
Hello, I'm Major Bolt. I am the Chief of the General Pediatric PCMH.
Thanks. Okay, so I guess we'll move on to what we're gonna do here tonight. Actually, a couple other things of business. I think so. We are recording this tonight, so we'll be able to put this up on Facebook and put the slides out on social media as well. So you'll be able to see that later. Or if you're here as a resident and you want to help communicate to your friends and neighbors, we're gonna please share that with them that we're gonna do that as well. And then if you go to the next slide, please, Steve. So here's our plan for tonight. I'm gonna get us started, and then we'll kind of move through the briefers here tonight to cover some of the material that we've got. And then at the end, we're gonna have plenty of time for some questions if you have them, and I just ask if you come to the mic to ask those questions again so we can catch it all on the videotape for future. So we'll move to the next slide. So here's what I'm going to start us off with is really why we're here tonight. So we are talking about lead in on-base housing. And a little bit of background is started with a story on the 16th of August, a Reuters story that talked specifically about elevated blood levels and serious health effects for some children that may be related to lead exposure from housing. And this was a story specific to Fort Benning, Georgia. The Army Times followed up with a similar, the same topic, similar story, and then it started to be reported in other media outlets. So at that point, the Army said, hold on here. Let's take a look at all of our installations and see what we need to communicate and how we should best communicate with our residents. Because just in being clear and open and transparent about what's going on in Army housing. So I'll just pause here for a second, or trying to kind of caveat. So you're sitting on a joint base, right? It's a joint base Lewis-McChord. You may be Air Force, you may be Army, you may actually be a Marine, you may be Navy, or even Coast Guard. All 5 of those services sit right, or those services are right here on JBLM and in our housing. So while we're very joint here on JBLM, it's an Army-led joint base, which means the Army is the lead service in providing installation support. So that's why you'll hear me talk about what the Army is doing for their installation. The other thing to know about JBLM is that our housing here is privatized, which is why you heard me introduce the Lincoln Military Housing Leadership, because with privatized housing, that's a partnership that we have in the way that we provide housing here on JBLM. So that kind of brings the team together and sets the stage for what we're going to talk about. So what we're doing tonight is part of an Army-wide initiative. The Army directed that I do these forums for our residents here on JBLM. So what's happening this week across the Army and across Army installations is this exact same thing. Town hall forums, open the door, invite you all in, pass off the information and have some time to have some dialogue, but also talk to you about the couple of steps that are a part of the way ahead. So tonight is informational, and I'm really glad that you're here to receive that information and participate in dialogue if you want. It's not meant to alarm you. It's really about just laying out the information that we have and provide you, actually, you'll leave here tonight with some useful information about the hazards of the lead, the responsibilities that you have as a resident, the responsibilities that I have as the commander, and the responsibilities of the rest of the team here and what we do in on-base housing. And the other piece that you'll hear is our plan for what we're going to do in the days ahead as we get further guidance from the Army and as we assess our situation here on JBLM. So next slide here talks about, here's just to set the stage, this is where the hazards from lead come from. So in homes built before 1978, most of those homes have a detectable level of lead in them in the paint. So federal law defines that lead-based paint containing 0.5% or more by weight. So that's the definition of lead-based paint. And prior to 1978, that paint was used in homes all over the country. It was in 1978 that federal law then prohibited the use of lead paint. So in a home that was built before 1978 on an installation, off an installation, most likely contained lead-based paint. The next thing to understand is as long as that paint remains undamaged, there's really no hazard to having it, which is why many homes today, based on when they were built, still have lead-based paint. Now the problem comes when the paint deteriorates, when it starts to chip, when a window is going up and down and rubs against each other and creates dust. Those are the things that are hazardous and can be released into the air, into the environment, if we're not careful about the way we take care of them. So we're talking primarily about paint, but there's other sources of lead hazards. So it can be in drinking water, it can be associated with hobbies that have to do with soldering lead or even stained glass, making stained glass. There's hazard there. Sometimes some old toys, ceramic dishes, those kinds of things can also contain lead paint. So that's really where the hazard comes from. If you go to the next slide, so this is where you will start to neck this down to what this means for JBLM. So on JBLM, we have 5,161. Did I get that right, Nancy? Yeah. So a little over 5,000 homes on JBLM. 3,324 of those homes were built before 1978. So you can see 12, I think, of our 17 communities here on Joint Base Lewis-McChord have homes that were built before 1978. And you may, if you look at those, hopefully you'll recognize some of those neighborhoods, and you may even be a resident in one of those neighborhoods. But that is the scope of the homes that we're talking about. And so it makes sense, right, that the Army would say, hey, we probably need to get the residents together and give them some information about it, since more than our homes here on JBLM were built before 1978. So, Steve, have I effectively set the stage? So I'm going to hand off to Mr. Perrineau, our Director of Public Works, to talk you through some of the things that we're doing here or kind of set the rest of the conditions for JBLM, but also talk about the way ahead.
Thank you, ma'am. Again, I'm Director of Public Works. Before we get to the housing portion of it, I'm going to talk about the non-housing. If you live on the installation, one or both of the adults that live in the house works on a building in JBLM probably. So I'm going to talk about the 2,000 plus buildings that you will work in. Many of those were pre-1978 construction. So there's going to be lead-based paint in those. Because there's so many of them, we rely on the occupants to identify if they see dust or if there's paint chips. They will call the number up there, 3131, hit option 2, you call DPW, and we'll take that as a priority 1 issue, and we'll go out there and assess the damage or that you see in there. So you would call us. Also, there's 14 facilities on JBLM that have children in them. So that could be a CDC or a Child and Youth Services building. 11 of those 13 or 14 were built after 1978 and will not have lead-based paint in them. The other 3 will most likely have lead-based paint in them. Excuse me. First, the water. Water is tested on every 3 years. Is that correct, or 3 or 5? Every 3 years, and there's no detectable lead, or their lead, it meets all EPA standards. Now, all buildings, all 14 of those buildings are inspected on an annual basis by G9, which is at MCOM headquarters, and it's a very stringent inspection of those buildings. But we will add the 3 buildings that were built prior to 1978 to this program that the Army has started to just recently. So they have all been deemed safe. Again, they're inspected on an annual basis. It's extremely stringent standards that they meet. Clover Park School District runs all 5 of the elementary schools on JBLM. We are very blessed that they're all almost brand new over the last 5 years. We have talked to Clover Park School District. They do their testings in accordance to EPA, and they meet all the standards, as we would expect being brand new facilities. Okay, as Colonel Lucas said, the Army has started a program. What we are to do in the middle bullet is we are going to, well, actually we already did the first step. We are here to validate that our partners meet all the requirements of lead-based paint. And we have already checked the records, we have already validated the procedures, and they do meet those. And Mr. Tom Brown will discuss those on his slides. So we've already met that first one. The second one, we will visually inspect 10% randomly houses on JBLM that were constructed prior to 1978 and have children under 6. After that, we will review those results with our partners, Lincoln Military Housing, and find out and decide if further testing needs to be done. Okay, our way ahead. Again, we're going to look at houses. We're going to look at pre-1978 houses with children under 6. And we say, why children under 6? They're the most vulnerable for lead, the reaction to lead. So that's why we're doing that population of houses. As Colonel Lucas says, we have over 5,000 homes. 3,324 of those were built prior to 1978. 1,525 of those houses were built pre-1978 and have children under 6 years old. So we were going to do 10% of that 1,525, which is 150 homes. So that's why you see that we're going to do a visual inspection of 150 homes with children under 6 years old. Again, that's the most vulnerable population. Again, after that visual inspection, we will look at the results. We'll sit down with Lincoln and we'll come up with a plan if anything else needs to happen. Okay, what can you do as a resident of a home if you live in a home that's been constructed previous to 1978? You need to look at what you use as far as cooking is concerned. You know, your utensils, your cooking ware, and everything. Some of those may contain lead. You need to make sure they don't have lead, especially if you have children that are under 6 years old. The other thing you need to do is look at your hobbies. If you do stained glass window, for instance, there's a lot of lead in that. So you need to look on what hobbies that you do, how does that impact your children, especially if, again, if they're under 6 years old. As far as your house is concerned, cleanliness is important, especially if you have windows. Again, as Colonel Lucas said, that wear and that abrasion can cause dust. So it's important to keep your windows clean. Wipe them down and keep them clean. The other things you need to look at is the toys that your children play with. Some toys have lead in them. So you need to make sure that you have toys that your children use that do not have lead. That's what you can do to help us, or help you. So what I'd like to do now is hand this over to Tom Brown, and he's going to talk about what Lincoln Military Housing does. Again, we've already looked at the procedures, and we feel very, very confident that they follow all the procedures required by law.
Thank you, Steve. Again, I'm Tom Brown with Lincoln Military Housing. Thank you for coming tonight. I just want to start off by saying that Lincoln Military Housing is privileged to be able to manage the housing here at JBLM, and our primary mission is taking care of the families. We're here as a resource for you. If you have questions, please ask them. We're happy to answer those. I've got Nathaniel Stevens, who is the regional property manager for JBLM, and John Shear, who is our regional maintenance director, who administrates the LBP program here, helped develop that. And they're both great resources, so we can answer any questions you might have. Again, kind of as a recap, there's 3,324 homes here that were built before 1978. All the homes have been inspected to determine potential locations where lead-based paint may be present inside the homes. And we have an operations and maintenance plan that guides any work that we do that involves lead-based paint. And that meets all the EPA and HUD guidelines. We follow all those guidelines. We also do an additional 10% sampling on an annual basis. It's over and above what the EPA requires, just for our own peace of mind. And we have those inspections available for our residents in the office. If you want to take a look at those records, they're available for you. We also do an annual PMI inspection where we look at not only the smoke detectors, furnaces, things like that, but we inspect the paint inside the home as well. And if we find paint that is chipping or there may be dust around windowsills, we'll take care of that with a service ticket through our service teams. When we do any major work on base that is a capital project like renovation or large renovation repair projects, we make sure that any of the contractors that we hire are EPA certified to be able to deal with lead-based paint and handle that properly so the residents are not exposed to that. Just as a reminder, all of our residents at lease signing will get an EPA pamphlet called Protect Your Family from Lead in Your Home, which kind of outlines what the EPA guidelines are and reminders for residents on how to live in a home that may have the potential for lead-based paint. We also have the residents sign a lead-based paint addendum if they're in a home that is built before 1978, so they're aware of that fact. And we did bring additional copy of those tonight, and Nathaniel has those if you want those for a resource. Okay, before residents move in, our teams go through and do a thorough maintenance of the entire home from floor to ceiling. They inspect all of the appliances, they look at the paint in the home. If it needs spot painting, they do that. If it needs a complete paint job, they'll do that as well to make sure that any LBP in that home is stabilized before the residents move in. And then before the residents move in, we walk the home with the residents as well. That's their opportunity to take a look at the house in its entirety to let us know if they note any discrepancies that need to be taken care of, whether it be appliance related or if it has to do with the paint. And we make sure that is taken care of before the resident moves in. And then this kind of, again, talks about the preventive maintenance. That's an annual basis, and we do that at every home at JBLM once a year. If a resident has a concern, they can call our 24-hour-a-day maintenance hotline. They will dispatch a tech if it's LBP related, and we classify that as an urgent ticket, meaning that we will be to that home within 4 hours to assess that situation. Depending on the level of the inspection, if it's less than 6 square feet, our teams can take care of that. If it's on the inside of the home, if it's an area that's more than 20 square feet on the outside of the home, then we'll use an outside LBP certified remediator to take care of that. So it's a third party that would handle that for us. If we were into a situation, say there's a flood in the second floor and it floods through the ceiling and into the walls, and it's going to be a major repair where the resident's going to be out for a while, we may either transfer them to another home or put them in the temporary accommodations at our expense until those repairs are made and that the home is deemed safe to return to. And again, after that work is complete, then the third-party contractor goes in, certifies that everything has been remediated as it should be, meeting EPA standards, and then it's safe for the resident to return to the home, and that it's visually inspected, and they do a dust test as well. So I think our thought processes are very, very thorough. They've been in place since the beginning of the privatization back in 2001. And I think we do a very good job following all of that process, and John's team is outstanding. So with that, I will turn it over to Madigan.
Good evening. So once again, I'm Major Bolt. I'm the chief of the General Pediatrics Patient-Centered Medical Home. So here we just want to talk to you about the health effects of lead. So lead is not necessary for normal human function, and lead should not reside in the body. Lead can be potentially harmful if it's found in the body at very low concentrations. What we're looking for is our population that is very vulnerable is our 6-month-old infants up through our 6-year-old children. That is the target population that we are screening for. Lead can impact a normal brain development, having reduced function of the brain, having some problems in school, behavior problems, attention problems, and sometimes developmental problems. Children can come into exposure with lead by breathing in dust from lead paint, either that is being sanded or, as was mentioned, the windows going up and down when there is old paint and the paint is chipping. Also, if there's chipping paint on the floor along the baseboards, little children who are crawling around and playing with toys, or they're exploring their world and they put lots of things in their mouth, can pick up paint chips and ingest them. Also, if there was any contaminated food or water, or other consumer products that have been mentioned, like there's certain toys, certain jewelries, pottery. If children are drinking from handmade or artistry pottery, that can also be an exposure for lead. So your healthcare provider can help you determine if your child is at risk for lead exposure. So if you do have some health concerns, the first thing we want you to do is go ahead and discuss these concerns with your child's primary care provider during their scheduled exams, or through the secure messaging through the MHS Genesis patient portal, or by scheduling an appointment. Here in the Army, for Army Pediatrics, we follow the lead screening guidelines that are established by the American Academy of Pediatrics and by the Washington State Department of Health. And regardless if your child is being seen in an Army pediatric clinic or in a civilian pediatric clinic, pediatricians have been screening for lead exposure for many, many years. And this is nothing new. This is something that we do routinely. And parents can often tell you how many times we ask them about 10 questions in a row related to lead exposure, how old their house was, etc. So based on the results of our surveys and the interaction that you have with your provider, we'll determine if there is a risk, and if there is a risk, go ahead and order the blood test to check for the presence of any lead in the body. So lastly, just to give you some more information here, the Army Public Health Center has a web page that shows you how to protect your children, and there's a couple of very good links here. You also have links to the Environmental Protection Agency, the CDC, the American Academy of Pediatrics link, and also the Washington State Department of Health. And I would just like to highlight that the questions that our current medical system uses and that we're currently using in our pediatric clinic actually include all of the questions from the Washington State Department of Health, and then there are a few extra questions that we do ask specifically about your hobbies, specifically about places your child may reside but not live, like in daycare, grandmother's house, etc. And then also what your profession is. Does your profession expose you to lead that you may then bring home to your children on your uniform, or on your clothing, or on your shoes? Questions?
All right. So what we did here was lay out, here's what the Army's doing, here's the background, here's the status of things on JBLM, here's what the housing partner does do with regard to lead paint in housing, and has been doing for quite some time, as well as cover what those risks might mean to that vulnerable population, and things that you can do to be informed and stay informed about lead and the hazards of lead. So with that, I'd like to just give you an opportunity if you have questions or concerns. I'd love to hear them, and we'll be happy to take any questions you have. I just ask if you don't mind using the mic there in the aisles. Okay. So, oh, I'm sorry.
Okay, so these might be stupid questions, but just very basic, because I came because I don't know anything about lead, and my husband's never home, so it's up to me. So basically, if we hammer a nail into the wall or drill a nail into the wall, we're going through lead-based paint and creating microscopic amounts of dust, and that's probably not a concern, I'm guessing. Or should be, or...
So those kinds of, I mean, you guys are welcome to chime in, but those kinds of, that's the cleanliness aspect, right? If you hammer a nail in and there's a little bit of dust or residue, that gets cleaned up, and that's fine.
And then actually just Monday morning, I had a pipe burst in the wall in our bathroom, and maintenance was wonderful housing when they were there in less than 20 minutes. But I'm realizing they took out, the baseboard out, and they had to cut out, maybe less than a square foot of wall, and they fixed it, but they left it open because they had to dry it, the mold prevention, yada, 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 but nobody ever said anything about keeping my kids out of that bathroom. Now, they haven't been in there because it's the one in the master, but and they'll be back within the week to patch it up and go, but essentially that's where exposures could come from, correct? Just from that.
Yeah. Do you want to, or John, do you want to? Join us.
So I think the big thing is to make sure that we are securing that area for sure. And we wouldn't want it, especially if you had a young child that may get in there, crawl in there, and grab something. Of course, the technicians should clean the areas. There should be no dust left over. But we need to leave it exposed so that we can get it dried out. That's the tough thing with water. But thankfully, with water, usually you don't have dust and it is cleaned up. So definitely, they should be leaving that area in a condition. If not, they should be securing the area so that your kids or you wouldn't get exposed.
Do you have more?
Yeah.
It's good. No.
I followed all your math, and the 1,500 houses, the 10%, 150, but essentially, I mean, we're the Army. The housing is changing over and over, so you're only sampling 10%, but at any given time, there's different houses that are going to have children under 6, and if you look at the number of neighborhoods, that's really only, maybe 3 to 5 houses per 5 houses per neighborhood at most that we're inspecting. So in hindsight, it seemed a little bit small. And I mean, initially 10% sounded great to me until I followed the math all the way down to the 1,500 and 10% of that, as opposed to 10% of the 3,300 or whatever it was.
Right.
That were pre.
No, that is a great point on the math. It's actually one that we discussed as a group. And really what this is a point of departure, right? So it allows us to sort of get a grasp over the over 3,000 homes. Okay, what is the best strategy to be able to get an assessment? And we wanted to make sure we of course looked at homes with the vulnerable population, but also that we didn't, miss an entire neighborhood in that process. So you're right, but this is kind of our jumping off point. And the other point I want to make is what you heard Mr. Perrineau say is what we have done, and we feel very confident, is we've validated the housing partners process already. So so 10% may seem small, but this allows us to do that, physical validation of that now as the next step. There's a couple of things that you may have picked up on as you heard this. So I think if you were, as an individual, if I was worried about my specific home, I think I could call and ask whether that home, when was the last time it was checked, and we'll be able to share that information. Or you could also, let us know if, again, through the your medical provider, if you have any concerns where you've got, you're starting to see the data lined up, you just come up on the net through the right channel, and we will address that. But that sampling is kind of the best way that we could to get, as broad a scope and really have our point of departure on the next step. But you're totally right, and we had that same conversation. So,
And
but
that-
once I get this feedback, then we'll have a better sense of, okay, what is required next? If anything, but it's definitely, it's our first step there.
And that 10% is going to be split through the neighborhoods, not
Yep.
just
Well,
all.
and yes. I mean, that's the point of it is, if we ended up, and you guys know based on who lives in the neighborhoods, right? Some of these neighborhoods have a lot more tiny kids than where the old people like me live. So we'll manage that based on the way the math comes back to make sure we're
Okay.
evenly spread, but also staying focused on that 6 and under population.
Thanks.
Good. I love that you got up and asked the question. For me, I can tell you obviously I'm in the Army, I'm dual military, I'm a mom of 3. I live in a house built before 1978 on JBLM. So for personal reasons, I have the same concerns as many of you if you're sitting in here tonight. But in the bigger picture, I have concerns about the entire installation because my job, our job, the team that's sitting here is focused on making sure we provide you that safe housing and that we're really maintaining your trust as we do that. Go ahead. It looks like you have some that are under the age of 6.
All right, yes, ma'am. I may have missed it because I came in a little bit later, but I know that the school sent home last year at the beginning of the year some information from public health regarding the lead and the arsenic in the soil in this area, and there's also signs in DuPont at several of the parks regarding, don't dig, don't play outside of the designated playground area, do not let your kids play with anything out there. I'm assuming that automatically puts this general area at an overall higher risk than some other areas. And how does that account for like some of the playground and other?
Paul. Now you get to join us. That I'm really proud of you.
We're bringing everybody up.
No, that's good. You're reading the material that's coming home from school, and you're obviously reading the Facebook page that says,
Right.
"Come to this town
Right.
hall," so good for you.
So I'm the environmental chief. I work for Mr. Perno in Public Works. And I've worked here since 1990. So I have a little history here on discuss the thing, what you're chatting about there. I'm not so much sure about lead, but I do know that with arsenic, there was a smelter in the area known as the Arsarco smelter. And you are correct. There are elevated levels of arsenic scattered throughout the Puget Sound area as a result of the operation of that smelter in the past. There's been a lot of testing that's been done, and I wouldn't call it an extreme hazard, but it's something to be noted, and it is something to try to, avoid having your children, play around in the dirt a lot or eat the dirt a lot. I wouldn't be
vegetables.
overly concerned about it. I raised my children here. Like I said, I've been here since 1990. My youngest was born in the area here, and children are going to be children. They're going to play around in the dirt, and they're going to get into the dirt and all that kind of stuff. So, I don't think that there's an extreme hazard associated with it. The EPA was involved with the work regarding the soils in the area in regards to the Arsarco smelter issue. And they have essentially deemed it to be at safe levels, but they have put what's called institutional controls in. It's just not practical to go out and remove the top layer of soil throughout the entire Puget Sound area. Mm-hmm. So instead, they do what they've done with your schools. They've put information out to folks and to parents and told them, to take some prudent measures to protect the children when they're out playing outside. But I don't think it means they shouldn't play outside. I think you're going to get better benefit from playing outside and more sanity, if I remember my days of raising my kids in the household, by having them play outside.
Is there, so like as this young lady had just said, is there a means to communicate that for parents who homeschool?
Honestly, I'm not familiar with the mechanisms for that type of communication, but I believe there is a website on the Arsarco smelter issue, so we can certainly try to get that information out to folks.
Okay.
Okay. we'll get the information to them, and then they can get the information out to the folks who homeschool.
Okay. And then I know part of that information when they talked about when they sent home the pamphlets on the lead and arsenic elevated levels within the soil in this area, they did the same thing as far as communicating the importance of cleanliness within the home, that you should, they sent home a special cloth to dust the windowsills at least once a week and all that business. And one of the issues with, I know, especially the older homes, one of the issues is sometimes the windowsills, I mean, it seems simple enough to wipe them down, but the way that they're built are, I know at least in our home, there's a lot of like lips and there's edges. So there's a lot of corners that are very difficult to actually clean out, not to mention that the windows either don't seal very well, and so there's constantly, anytime there's a storm, like yesterday, I had a lot of water that came in. Or some of the windows don't even open because they've probably had, 60 to 80 years of paint that is trying to keep the lead, contained. But I just didn't know if there's something that we could do maybe to replace kind of the windows in general are kind of in a sad state in some of the Broadmoor areas.
So I'll, so a couple of things. I don't know, you want the whole history lesson on historic homes. But the first point is, if you have any concerns at all about your windows in your home and the construction of those or the way they might be generating, just call that number for Lincoln, and we will be able to address that. So that's probably the first point. The bigger picture about, we talk a lot about all the things that we can do to continually improve our housing, and the windows in some of our older homes is one of the things that we have talked about over the years. There's kind of all folks involved, like the state historical office cares about what happens in the historic homes on JBLM. So, but when we talk about those issues, especially with the partner, it's always about the safety of our families in mind. And we are a learning organization between me and between the housing partner, so hearing this feedback is definitely another layer of the conversation that we can bring into that discussion, as well as, when we come out to respond to a work order, making sure that we're kind of over communicating about what work has just been done in your home and, what that means, especially if you have small children running around. So your feedback is great. And if you have for everybody, if you have an individual concern about your home, all you have to do is contact Lincoln. And I think we put those lead-based paint ones are urgent, so you'll have someone on your doorstep in 4 hours.
Yes, ma'am.
Yep.
Okay. I was going to say it's pretty systemic. I know our neighborhood is pretty tight knit, so we all frequent each other's homes. And it seems like everybody's windows, and some are worse than others, but it's definitely our whole block, basically. So you're looking at 5 different buildings, 5 homes in each building. So
I'm going to do my shameless plug here for a couple of things. One is, call and tell your neighbors to call. And it sounds like I know exactly where you live. Not exactly, but don't worry. I'll be by to make sure. Right here. Make sure you're not running your sprinkler when you're not supposed to. No, but
it's not me.
I know what you're talking about, and make sure you're communicating. You're the neighborhood rep now here, so make sure you're communicating when you get back about.
Yes, ma'am.
Make sure you call.
Okay.
And the second one is there's other opportunities throughout the year where we want your feedback, and one of them is the survey that comes out every year. And if you didn't, do not tell us we're doing a great job. Right? We want to hear, I don't like the blinds. The windows don't seal properly, and guess what? It rains here, and I get water in the house 8 months out of the year. That's the kind of, am I right, Nathaniel? That's what we want? That's the kind of feedback that we want, because we can't be in every home.
Right.
But you guys are in every home.
Yes, ma'am.
Right? If we get your feedback. So I'll get off the soapbox, but tell your friends, because we love the feedback that says we're awesome. But we also live in the real world where we want the feedback that helps us provide, that safe environment for those 2 little guys there in the back with you. They're behaving. They're so cute.
I know, I don't know what's happening back there. So. All right, thank you, ma'am.
All right. Yeah. Oh, yeah.
We absolutely want the kids to play outside. We want them to play in the dirt, and generally exposure to dirt helps build our immune system, all right? But one thing, what your mother always told you is to wash your hands before you eat, okay? So if your kids are playing in the dirt and there is an unrecognized area where there may be an increase for arsenic in that soil, as long as your children are not consuming that and they are washing their hands before they eat, that's just another basic safeguard.
All right. Any other questions? I feel like we're being graded by the group here in the...
So
Yes,
my kids are 1 and 3, which is why I don't get the school notices.
Right.
But I didn't know about this dirt thing. And I mean, if I could show you my phone, I have a picture of my 18-month-old with mud on his face from yesterday because I put them in the rain jacket and set them out because it was the first time they could splash in puddles, you know, in the last several months because we just finished our nice summer. But like they literally, there's a little patch in our backyard because there's the woods come up to it where grass doesn't grow, and they dig in that dirt every single day. And I had never heard about this arsenic lead smelter thing, which, you know, I'll be Googling after they go to bed tonight. But are there places on base that this pertains to as well? I mean, I guess I haven't frequented enough parks in DuPont and haven't seen said signs. And
So those
like
communications...
she said,
of-
my kids play in dirt. They play outside for
Right.
hours on end. They've got great rain suits, and we're inside very little and outside all
Right.
the time. And
So what we're talking about here, we're talking about 2 data points that didn't originate from the installation, right? So of course we want to be aware of those, and there's certainly 2 things that I meet with Clover Park regularly, and then also the environmental folks here within DPW I know will take this thread back because the 2 pieces of information that we're talking about aren't specific to the installation. So we'll take some homework, but what I'll tell you is there's other things involved in our kind of this complete screening process that will, should put us all as moms and parents at ease, which is that the survey tool that you get asked every time that you go in for a well baby exam, right? That they're asking for any kind of things that might drive up your risk level that would cause them. So as long as you're kind of listening to that survey, answering those questions, that's another area where we would catch in the screening any kind of potential elevated risk. So again, I can't speak to what Clover Park and what the city of DuPont is putting out, but I assure you that if we have homework as an installation about that, we're gonna go to work on that, okay? But for tonight, no, from an installation perspective, I'm not telling you to not play in the dirt. Apparently we are telling you to wash your hands after you play in the dirt. That's you, Percy. But again, like having these forums it's wonderful to hear, as a resident, the kinds of concerns that are in your mind that, that we can address to make sure that, again, this is as safe as we can make it for the 1 and 3-year-olds to be able to play in the dirt. Thanks. All right. Are you sure? I don't want to, oh, do you want to join us? I'm just kidding.
So, just thank you very much for this forum and the chance to dialogue and just the transparency of what comes next for the community. And as one of the person's leadership, I'll take it back to my unit and make sure the information also gets disseminated. So we talked about the target as far as humans. I'm a pet owner. What's the risk to my dog? Anybody? On lead paint, anybody? Is there any risk to the animals? All right. I'm sorry, I'm just a dog owner. And
I mean, they're basically family members, right? No, it's a great...
He is. He's part of my family.
Certainly as a former dog owner myself, I appreciate how important they are in our lives. So I'm Rod Markham. I'm the Chief of Preventive Medicine here at Madigan. And in fact, there is, in the preparations for this venue today, there was a mention that the veterinarians have expressed concerns for lead exposure in animals. I can't speak to specifically what that is, but certainly as we move forward and we figure out, what, if any, challenges do exist, I will make sure to ask the veterinarians at Madigan what exactly those concerns are and figure out a way to go ahead and disseminate that information. There is no risk of transmission between humans and dogs, though. That's the follow-on question that usually comes, but thank you, ma'am.
Thanks. Okay, thanks. All right. I thought I saw a hand. All right. So we'll what we will do is, again, like I said, I've got a mixture of subject matter expertise from the installation, from housing, from Madigan, here with you tonight. So if you wanted to come forward and ask a few more questions or pick our brain after we're done here, please do that. We'll stand around here at the front. Thanks again for being here. You know, I say this all the time, is that there's nowhere, JBLM is huge, it's 90,000 acres, it's massive, there's 5,000 homes. There's no way I could be everywhere on this installation, but together we are everywhere on the installation. So getting a chance to interact with you and get your feedback, and really, you know, kind of part of the team effort about how we make JBLM what it needs to be today and tomorrow is really important. I'm really confident in what we've shared with you tonight, in what the housing partner is able to do for us here on the installation, and also what the Army intends to do as we move forward. And my promise to you is that I'm going to communicate with you, and I really want to maintain your trust throughout this process as we gain more information and as we take a look at what we may need to do here on JBLM. We are committed 100% to providing you the most safe environment that we can for housing, for work, for play, the spray ground, the bowling alley, the CDCs, whatever it is. That's our commitment to you, is that we provide that environment to you in the absolutely most safe way, so that you can, you know, enjoy your time here at JBLM as much as possible. Again, thanks for being here. To the team that's here tonight, thanks for the teamwork and the participation and everyone's commitment to what we do here. Thanks.